Hormones serve as vital chemical messengers produced by glands within the endocrine system, orchestrating nearly every physiological process in the human body. These include critical functions such as mood regulation, metabolic rate, sleep cycles, reproductive processes, growth, and the body's stress response. A hormonal imbalance arises when there is either an excess or a deficiency of a specific hormone circulating in the bloodstream, thereby disrupting this intricate and highly sensitive chemical communication network. The significance of hormonal equilibrium for women's overall well-being cannot be overstated. Throughout a woman's life, hormone levels naturally undergo predictable fluctuations during distinct physiological phases, including menstruation, puberty, pregnancy, and menopause. While these transitions are inherent to the female biological experience, any deviation from a balanced state can manifest in a diverse array of symptoms. These manifestations can profoundly affect an individual's personal comfort, cognitive focus, general health, professional performance, and interpersonal relationships. Consequently, the timely identification of these early indicators of imbalance is paramount. Such early recognition is foundational for implementing effective management strategies and for mitigating the risk of developing more severe, long-term health complications. The endocrine system operates as a highly integrated network, where the function of one gland or the level of one hormone can directly influence others. For instance, the menstrual cycle, a complex biological process, involves the coordinated action of several hormones. Disruptions in one area, such as chronic stress leading to sustained elevated cortisol levels, can profoundly affect the balance of other hormones, including reproductive hormones like estrogen and progesterone. This phenomenon is observed where chronic stress can deplete the precursors necessary for progesterone synthesis, leading to its deficiency. Similarly, an underlying thyroid dysfunction can manifest as irregular menstrual periods and impact fertility. This interconnectedness implies that a comprehensive diagnostic approach is essential. Symptoms that appear to be isolated may, in fact, be cascading effects of an imbalance originating elsewhere within the endocrine system. Therefore, effective therapeutic interventions often necessitate addressing the root cause, which may not be immediately apparent from the presenting symptoms alone. Women's hormonal profiles are dynamic, undergoing predictable and naturally occurring shifts throughout their lives. These include significant transitions during puberty, the reproductive years, pregnancy, and menopause. While these are normal physiological adjustments, they can sometimes precipitate temporary imbalances as the body adapts to new hormonal states. Puberty and adolescence. Initial hormonal shifts. Puberty marks a period of profound hormonal activation, initiating the development of secondary sexual characteristics and reproductive capacity. While detailed early signs of imbalance, specifically during puberty, are less extensively documented in the available literature, the general hormonal fluctuations characteristic of this stage are a significant factor contributing to the development of acneal reproductive years, menstrual cycle, and fertility. Considerations. The reproductive years are defined by a delicate and precise orchestration of hormones that govern the menstrual cycle. This period is particularly sensitive to hormonal shifts, which can manifest in various ways. Irregular periods. One of the most common and noticeable indicators of hormonal imbalance during the reproductive years is a change in the menstrual cycle. These irregularities can range from subtle deviations to dramatic shifts in timing, flow, or duration. Specific manifestations include missed periods, amenorrhea, or excessively heavy menorrhagia, or prolonged periods. Fertility problems. Hormonal imbalances represent a primary cause of female infertility. Successful conception relies on precise hormonal timing and balance for ovulation to occur. Conditions such as polycystic ovary syndrome (PCOS), anovulation, absence of ovulation, insufficient progesterone levels, elevated prolactin, or thyroid dysfunction can significantly impair fertility. Mood changes. Fluctuations in estrogen levels can directly influence neurotransmitters in the brain, such as serotonin, which plays a role in mood regulation. These fluctuations are often responsible for the symptoms associated with premenstrual syndrome (PMS) and, in more severe cases, premenstrual dysphoric disorder (PMDD). Subtle shifts in the 30s. As women progress into their 30s, even in the absence of pregnancy, subtle hormonal shifts may begin. These can lead to changes in the menstrual cycle, where periods may become shorter or longer, and the intensity of PMS symptoms might alter. Thyroid function can also undergo changes during this decade, particularly following pregnancy. Given that thyroid hormones influence metabolism, mood, and energy levels, any symptoms of fatigue, unexplained weight changes, or mood disturbances warrant attention. Perimenopause and menopause, the transition and beyond. These stages represent significant hormonal transitions marked by a natural decline in ovarian function. This transitional phase precedes menopause, typically commencing in a woman's late 30s or 40s and lasting anywhere from 2 to 8 years, with an average duration of approximately 4 years. During perimenopause, the ovaries gradually reduce their production of estrogen and progesterone, but these hormone levels fluctuate unpredictably. Common symptoms include irregular periods, which may initially become closer together before spacing out, vaginal dryness, hot flashes, night sweats, sleep disturbances, mood changes, and cognitive difficulties often described as brain fog. A decrease in libido is also frequently reported due to declining estrogen and testosterone levels. Menopause is clinically diagnosed after 12 consecutive months without a menstrual period, typically occurring around the age of 51. The physical and emotional symptoms experienced during menopause are generally a continuation and potential intensification of those encountered during The dramatic reduction in estrogen and progesterone can lead to more severe hot flashes, persistent night sweats, pronounced mood changes, significant sleep disturbances, increased vaginal dryness, and alterations in sexual function. Additionally, metabolism tends to slow during this period, contributing to weight gain, and bone density loss accelerates due to declining estrogen levels, increasing the risk of osteoporosis. The concept of early signs in hormonal imbalance often refers to manifestations that are subtle, nonspecific, or easily dismissed by individuals. Changes in the menstrual cycle, for example, can be very subtle for some women, making them easy to overlook. Similarly, symptoms of hypothyroidism often develop slowly over several years, with individuals barely noticing them initially. The indicators of elevated cortisol can also be subtle at first, only worsening over time if left unaddressed. Furthermore, insulin resistance frequently presents with no symptoms in its early stages, with more noticeable signs emerging only as the condition progresses towards diabetes. Many of these early symptoms can be confusing and are frequently misattributed to general stress or lifestyle factors. This insidious onset of hormonal imbalances emphasizes the critical importance of proactive self-awareness and consistent health monitoring, rather than waiting for debilitating symptoms to appear. Healthcare providers must remain vigilant in recognizing these subtle cues, and public health initiatives should stress that even minor, persistent changes warrant medical attention to facilitate timely diagnosis and intervention. Hormonal imbalances can manifest through a diverse array of symptoms that often overlap across different specific imbalances, making accurate early identification challenging without professional medical evaluation. The variability in symptom intensity, frequency, and duration among individuals is notable. Menstrual irregularities, changes in the menstrual cycle, are among the most frequently reported and often earliest indicators of hormonal imbalance in women. These can include periods that become irregular in timing, duration, or flow. Examples range from skipped periods, amenorrhea, to excessively heavy menorrhagia or prolonged bleeding. Such irregularities signal underlying disruptions in the delicate hormonal orchestration of the reproductive system. Metabolic and weight changes, unexplained fluctuations in weight, WHETHER, gain or loss, are common early signs of hormonal shifts. Hormones such as insulin, cortisol, and thyroid hormones are critical regulators of metabolism. Imbalances can cause sudden weight changes without alterations in diet or exercise. For instance, an underactive thyroid hypothyroidism slows metabolism, often leading to weight gain. Conversely, an overactive thyroid hyperthyroidism can lead to unexplained weight loss. High cortisol levels, often associated with chronic stress, can also contribute to weight gain, particularly around the midsection, face, and upper back. Insulin resistance can lead to weight gain as the body stores excess sugar as fat. Fatigue and sleep disturbances, persistent fatigue, a profound exhaustion that is not alleviated by adequate rest, is a hallmark symptom across many hormonal imbalances. This differs significantly from ordinary tiredness. Sleep disturbances, including difficulty falling asleep, insomnia, staying asleep, or achieving restful sleep, are also common. Hormones such as melatonin and cortisol regulate the sleep-wake cycle. Estrogen and progesterone also significantly influence sleep. Estrogen aids in maintaining sleep, while progesterone has a calming effect. Imbalances in these hormones, particularly during perimenopause and menopause, can lead to sleep disruptions and associated fatigue, mood and cognitive changes. Hormonal imbalances frequently impact mental and emotional well-being. Mood swings, increased anxiety, irritability, and depressive symptoms are particularly common with fluctuations in estrogen, progesterone, testosterone, cortisol, and thyroid hormones. Estrogen, for instance, affects brain neurotransmitters like serotonin, influencing mood. Chronic stress and elevated cortisol can lead to anxiety, mood swings, and depression. Cognitive difficulties, often described as brain fog, including trouble finding words, remembering, and concentrating, are also linked to hormonal shifts, particularly during perimenopause and with high cortisol or low thyroid function. Skin and hair alterations. Changes in skin and hair can serve as significant visual cues of hormonal imbalance. Persistent or severe acne, especially adult acne around the jawline or chin, often signals an imbalance between estrogen and androgen hormones and can be indicative of conditions like PCOS. Conversely, dry, itchy, or sagging skin can be a symptom of decreased estrogen levels, commonly observed during menopause, or a sign of thyroid problems. Hair thinning or excessive hair loss can be linked to imbalances in thyroid hormones, estrogen, or testosterone. Abnormal hair growth, hirsutism on the face or body, can indicate elevated androgen levels, potentially associated with PCOS or high cortisol. Sexual health and libido. Hormonal shifts can significantly impact a woman's sexual health and desire. Vaginal dryness, most commonly caused by a fall in estrogen levels, particularly during perimenopause and menopause, can lead to discomfort and slight bleeding during sexual intercourse. This dryness can also increase the frequency of urinary tract infections. A decreased interest in sex, or low libido, is also common, especially during perimenopause and early menopause, due to falling levels of estrogen and testosterone. Digestive issues. Hormones play a vital role in regulating digestive processes. Imbalances can disrupt normal gastrointestinal function, leading to symptoms such as bloating, constipation, diarrhea, or general abdominal discomfort. The digestive tract contains receptors for reproductive hormones, explaining why many women experience gastrointestinal changes around their menstrual periods. Temperature sensitivity. Fluctuations in hormone levels can significantly affect the body's thermal. Hot flashes, sudden feelings of warmth, often accompanied by sweating, and night sweats. Hot flashes occurring during sleep are classic symptoms of fluctuating or falling estrogen levels, especially during perimenopause and menopause. Conversely, an inability to tolerate cold temperatures can be a sign of low thyroid hormone levels, hypothyroidism, while sensitivity to warm temperatures can indicate high thyroid hormone levels, hyperthyroidism. Other early physical signs can include breast tenderness and swelling, which can be linked to both high estrogen and low progesterone. Headaches, particularly migraines, are frequently associated with hormonal changes during the menstrual cycle, pregnancy, or menopause. Urinary changes, such as sudden strong urges to urinate frequently, or loss of urine with coughing, laughing, incontinence, can occur as vaginal and urethral tissues change due to declining estrogen. The extensive overlap in symptoms across various hormonal imbalances presents a significant diagnostic challenge. Many of these manifestations are nonspecific and can be attributed to other common factors like stress or general lifestyle. This symptom overlap underscores the critical necessity of professional medical evaluation for accurate diagnosis. Relying solely on self-diagnosis based on symptoms can be misleading, emphasizing the importance of a thorough clinical assessment by a healthcare provider. Understanding the specific roles of key hormones and the distinct symptoms associated with their imbalances is crucial for early detection. Estrogen is a primary female sex hormone with extensive roles beyond reproduction, influencing cholesterol levels, bone health, heart health, and mood. Low estrogen. Early indicators of low estrogen often include irregular periods, hot flashes, night sweats, difficulty sleeping, reduced sex drive, and pain during sexual intercourse due to vaginal dryness, mood swings, dry skin, headaches, and cognitive issues like brain fog are also common. Long-term, low estrogen significantly increases the risk of weakened bones, osteoporosis, and cardiovascular disease. High estrogen, elevated estrogen levels, can manifest as breast tenderness and swelling, weight gain particularly around the hips and midsection, and fluid retention. Menstrual periods may become irregular with heavy bleeding, mood swings, increased anxiety, and worsening premenstrual syndrome. PMS symptoms are frequently observed. Other signs can include fibrocystic lumps in breast tissue, the formation of uterine fibroids, and potential worsening of endometriosis symptoms. Some women may also experience hair changes, memory loss, and insomnia. Progesterone is another vital female sex hormone, integral to the menstrual cycle and the maintenance of pregnancy. It helps regulate various bodily functions, including sleep. Low progesterone. Early signs of low progesterone commonly include irregular periods, short menstrual cycles fewer than 24 days, and spotting between periods. Mood changes, sleep disturbances, insomnia, anxiety, and depression are also frequently reported. Other symptoms can include low libido, hot flashes, and breast tenderness. Infertility is a significant concern, as adequate progesterone is crucial for ovulation and supporting early pregnancy. Hyperprogesterone, while often a normal occurrence during ovulation or pregnancy, high progesterone levels outside these contexts can indicate an imbalance. Symptoms may include breast swelling and tenderness, water retention, bloating, fatigue, anxiety or agitation, depression, reduced sex drive, and weight gain. High progesterone may also be associated with certain types of ovarian cysts. The thyroid gland produces hormones that regulate metabolism, energy levels, and body temperature. Hypothyroidism, low thyroid hormone levels. Symptoms often develop slowly and can be subtle initially. Early signs include persistent fatigue, unexplained weight gain often due to water and salt retention rather than just fat, increased sensitivity to cold, and a slowed heart rate. Depression, memory problems, heavier or irregular menstrual cycles, and thinning hair are also common. Untreated hypothyroidism can lead to high cholesterol and increased risk of heart disease. Hyperthyroidism, high thyroid hormone levels. Early indicators of an overactive thyroid can include unexplained weight loss, a rapid or increased heart rate, tachycardia, palpitations, and increased sensitivity to heat. Individuals may also experience unusual nervousness, restlessness, and irritability. Cortisol, often termed the stress hormone, is produced by the adrenal glands and plays a role in the body's stress response, metabolism, and immune function. High cortisol, hypercortisolism syndrome, chronic stress, or adrenal gland disorders can lead to persistently elevated cortisol levels. Early signs often include unexplained weight gain, particularly around the midsection, face, moon face, and upper back, buffalo hump. Other physical manifestations can include thin, fragile skin that bruises easily, slow wound healing, muscle weakness, and severe fatigue. Emotionally, high cortisol can cause severe anxiety or panic attacks, depression, mood swings, irritability, and cognitive issues like brain fog and insomnia. It can also interfere with other hormones, leading to irregular or absent menstrual periods, infertility, increased facial and body hair growth, hirsutism, and lowered libido. Low cortisol Addison's disease, while less common, deficient cortisol levels can also cause symptoms such as extreme fatigue, irritability, and sexual dysfunction. Insulin, produced by the pancreas, is crucial for regulating blood sugar levels and how the body uses energy. Insulin resistance. In this condition, the body's cells become less responsive to insulin, leading to glucose accumulation in the blood. Early signs of insulin resistance can be subtle or even absent. However, they may include strong cravings for sweets and salty foods, persistent fatigue, increased hunger or thirst, and frequent urination if progressing to diabetes. Physical signs can include dark, velvety patches of skin acanthosis in the armpits, groin, or neck, and the development of skin tags. Research also links insulin resistance to hair loss and menstrual irregularities, particularly in women with PCOS. Untreated insulin resistance is a significant precursor to type 2 diabetes. Hormonal imbalances in women are multifactorial, stemming from a complex interplay of lifestyle choices, environmental exposures, underlying medical conditions, and certain medications. Lifestyle factors, daily habits significantly influence hormonal equilibrium. Diet. A balanced, nutrient-rich diet is fundamental for supporting the production and regulation of hormones. Conversely, poor dietary choices, particularly a high intake of refined carbohydrates and sugar, can lead to insulin spikes and insulin resistance, negatively impacting overall hormone levels. Plant-based foods containing phytoestrogens, such as flaxseed and lentils, may, in moderation, help to modulate estrogen levels. Stress. Chronic psychological stress induces the sustained overproduction of stress hormones, notably cortisol, by the adrenal glands. While acute stress responses are normal, prolonged elevation of cortisol can disrupt the delicate balance of other hormones, including reproductive hormones like estrogen and progesterone. This can lead to a cascade of effects, including irregular menstrual cycles and sleep disturbances. Sleep, both insufficient duration and poor quality of sleep, are significant contributors to hormonal dysregulation in women. A lack of adequate sleep can keep cortisol levels elevated throughout the day, making it as disruptive to hormonal stability as chronic stress. Sleep deprivation can also impair the production of other crucial hormones, including growth hormone, essential for cell regeneration and metabolism, melatonin, which regulates sleep-wake cycles, and various reproductive hormones. Physical activity. A sedentary lifestyle can contribute to hormonal imbalances by adversely affecting metabolism, stress levels, and weight management. Regular physical activity, such as brisk walking, yoga, or swimming, supports hormonal health. Obesity. Excess body weight, particularly visceral fat, acts as an active endocrine organ, producing hormones and inflammatory molecules. This can disrupt normal hormone signaling and contribute to conditions like insulin resistance, PCOS, and thyroid disorders. The profound influence of lifestyle factors on hormonal health highlights a critical aspect. A significant proportion of hormonal imbalances are preventable or manageable through conscious, modifiable choices. This perspective empowers individuals to take proactive steps in their health journey, shifting the focus from solely medical intervention to comprehensive self-management. Environmental factors. Exposure to endocrine-disrupting chemicals, EDs, found in various pollutants, personal care products for example, phthalates, parabens, triclosan, and plastics can significantly interfere with the body's natural hormonal balance. These chemicals mimic or interfere with natural hormones, affecting their production, action, and elimination, and are linked to various health concerns, particularly women's reproductive health and conditions like PCOS. Medical conditions. A wide range of underlying medical conditions can directly cause or contribute to hormonal imbalances. These include common endocrine disorders such as polycystic ovary syndrome, PCOS, thyroid diseases, hypothyroidism and hyperthyroidism, and various types of diabetes, type 1, type 2, gestational, autoimmune conditions, where the immune system attacks healthy tissues for example, Hashimoto's disease affecting the thyroid, are also significant causes. Furthermore, tumors, adenomas, or other growths on endocrine glands, as well as damage or injury to these glands, can disrupt hormone production. Certain rare genetic conditions, such as Turner syndrome, can also lead to imbalances. Medications. Certain medications can directly affect hormone levels by interfering with the glands that produce hormones, either increasing or decreasing their output. Common examples include hormonal birth control, steroids, antidepressants, and thyroid medications. It is important to note that not everyone taking these medications will experience hormonal imbalances, but their potential impact should be discussed with a healthcare provider. Given the subtle and often overlapping nature of early hormonal imbalance symptoms, and the potential for these imbalances to precede more serious health conditions, early detection and professional medical consultation are paramount. Seek medical advice. It is essential to consult a healthcare provider if persistent symptoms are noticed, such as ongoing fatigue, mood swings, or irregular periods that do not improve with lifestyle adjustments. Any sudden or severe symptoms, including rapid weight changes, extreme mood swings, or significant hair loss, warrant immediate medical evaluation. Furthermore, if symptoms begin to interfere with daily functioning or quality of life, professional guidance is crucial. Keeping a symptom diary can be a valuable tool to help individuals and their doctors identify patterns and triggers. Diagnostic approaches. A healthcare provider will typically conduct a thorough clinical assessment, which may include a review of medical history, physical examination, and specific diagnostic tests. Blood tests are commonly used to measure hormone levels, such as estrogen, progesterone, thyroid hormones, TSH-T3, T4, cortisol, and insulin. Other tests may include 24-hour urinary-free cortisol tests or late-night salivary cortisol tests to assess cortisol rhythms. Imaging tests, such as MRI, may be utilized to check for tumors or abnormalities in endocrine glands like the pituitary or adrenal glands. Saliva testing can also be valuable for measuring unbound hormone levels available to act in the body. Role of reputable health organizations. Reputable health organizations play a pivotal role in advancing the understanding, prevention, and early detection of hormonal imbalances in women. The Women's Health Initiative, WHI, for instance, is a landmark study initiated by the U.S. National Institutes of Health, NIH, focused on major health issues affecting postmenopausal women. Its vision is to improve health through research on risk factors, prevention, and early detection of serious health conditions. WHI research has significantly impacted medical practice, influencing understanding of hormone replacement therapy, and contributing to a decrease in breast cancer rates in postmenopausal women. The WIST Institute's Women's Health Catalyst exemplifies a forward-thinking approach, focusing on addressing critical gaps in therapeutics, diagnostics, and medical devices specifically for women's healthcare. This includes pioneering research into the vagina-brain axis to understand connections between the microbiome, brain, and women's health in treating hormone imbalance-related diseases. They also explore long-term hormone delivery methods for conditions like autoimmune diseases, which disproportionately affect women. These initiatives highlight a crucial shift towards recognizing women's health as a distinct and complex field, extending beyond reproductive health to encompass the systemic impacts of hormones on cardiovascular, bone, neurological, and autoimmune systems. Such dedicated research fosters innovative, interdisciplinary approaches to understanding and treating hormonal imbalances, pointing towards future advancements in diagnostics and therapeutics. The early signs of hormonal imbalance are not merely uncomfortable symptoms, they are often crucial warning signals for the potential development of more severe, long-term chronic health conditions. For example, declining estrogen levels after menopause significantly increase the risk of cardiovascular disease and osteoporosis. Untreated hypothyroidism can lead to heart problems, peripheral neuropathy, and infertility. High cortisol levels are associated with increased risks of cardiovascular disease, osteoporosis, and diabetes. Furthermore, untreated insulin resistance can progress to type 2 diabetes. This perspective elevates the urgency of early detection and intervention, positioning hormonal health as a foundational element of overall preventative medicine. Addressing these imbalances promptly can substantially improve long-term health outcomes and reduce morbidity across a woman's lifespan. Hormonal balance is fundamental to a woman's health and well-being across all life stages, from puberty through the reproductive years to perimenopause and menopause. The endocrine system, a complex and integrated network, ensures the precise regulation of countless bodily functions. When this delicate balance is disrupted, the body signals these changes through a wide spectrum of early indicators. These early signs, though often subtle and nonspecific, can profoundly impact daily life. They manifest across various physiological systems, affecting menstrual cycles, metabolism, sleep patterns, mood, cognitive function, skin and hair health, and sexual well-being. The challenge in early detection lies in the overlapping nature of these symptoms across different hormonal imbalances, making self-diagnosis unreliable. A significant proportion of hormonal imbalances are influenced by modifiable lifestyle factors, including diet, stress management, sleep quality, and physical activity. Environmental exposures to endocrine-disrupting chemicals also play a role. Beyond lifestyle, underlying medical conditions and certain medications can directly contribute to hormonal dysregulation. Recognizing these early signals and understanding their potential implications is critical. These seemingly minor symptoms can serve as vital warnings for the development of more severe, chronic health conditions such as cardiovascular disease, osteoporosis, and diabetes. Therefore, proactive health management, coupled with timely and professional medical consultation, is indispensable. Healthcare providers, equipped with comprehensive diagnostic tools and a holistic understanding of the endocrine system, are best positioned to accurately diagnose imbalances and guide appropriate interventions. Continued research by dedicated organizations further enhances our ability to detect, prevent, and treat these conditions, ensuring improved health outcomes for women globally.